because he's hearing the Can you hear me? Okay, here's an alternative. If we can put one of those on this afternoon's press conference. Joining us this afternoon is going to be Mayor Dean Margot, County Judge Ricardo Samaniego, and also Dr. Hector Ocaranza, the City County Health Authority. Additionally, in support will be joining us is Assistant Fire Chief Jorge Rodriguez, who is the Office of Emergency Management Coordinator. And we're going to go ahead and start it off with Mayor.
We still have some people setting up, so let's give them another 30 seconds.
A few more minutes for some media.
Hospitalization rate, because if you all will recall, the governor has set a 15% threshold on hospitalization rates for COVID. Dr. Ocaranza will be providing further information regarding the recent spike in a few minutes. The flu season has officially started, and it is imperative everyone get a flu shot this year. Chief Rodriguez will talk about where we are on that. Starting October 5th, the City of El Paso's Department of Public Health will be offering free flu vaccinations for everyone 6 months and older at no cost, and no appointments are needed. For information regarding free flu shots, please visit bepowerflu.com, bepowerflu.com. There have been questions about the opening of the zoo. While we have had some spikes and where we are, the last couple of days have had some decreases. As I think I said, on September the 29th, we had 173 COVID hospitalizations. The 30th were 178, and today we have 166. So there's been a bit of a decline, which is positive. But Dr. Ocaranza is stating that we will officially notify the city that it is permissible for the zoo to open, and it'll be up to them to handle their staffing accordingly and be able to do that. So let me turn it over to Judge Samaniego for his comments, and then we'll go to Dr. Ocaranza.
Thank you, Mayor. Good afternoon. And last time we were here, we talked about it's really now up to the community. And so we're really looking forward to getting our community to engage properly. We talk about the virus trend, but we also have a community trend, and the community trend is that we have a holiday, the peak goes up, there's more spread, there's more community spread. Sort of combined with the governor's orders of trying to go from 50 to 75% in some of the areas, and that complicates the situation. So I think, once again, the mayor and I are calling for a community to be more responsive. We've got we've got Halloween coming up, we've got Thanksgiving coming up, we've got Christmas coming up, we've got New Year's coming up. And if you look at that trend, and then we look at the flu season, the peak, it starts actually, the flu season starts today, but the peak is in January. If we bring those two together, that could be pretty disastrous. So as we're trying to open the economy, and you have the numbers going up, it really complicates situations for the mayor and I. I'm trying to figure out what we can and cannot do. The mayor will be working on the Halloween situation along with myself as to what are some of the legal things that we could do. But I think we do need to have the community on its own do what they need to do to make sure that the community spread doesn't continue. The hospitalizations, we had a peak in hospitalizations, but we had a drop, so we still don't know if there's a trend. So if we look at the community responding to, we keep doing the right things and not be taken by or taken aback by whether it's 75% and we relax, or that we feel that things are getting better and we can take our masks off, and we go down that line. January, people at the beginning, the mayor and I said that the chances of September, October being out of this situation, and people were sort of concerned that we were being a little pessimistic. But here we are going into October, and we still have peaks coming at us. So once again, lots of things we're going to talk about today, but the most important thing, the community has to respond properly, and we have to do the right thing at all times. The washing of our hands, the wearing the masks, and that in itself will prevent some of the challenges that we have going forth. And I also want to thank Dr. Ocaranzo and a lot of the things that he educates us on. If we take them to heart, then I think we're going to be successful. So thank you very much today. We'll discuss some of the other areas of concerns going forward. Thank you.
Good afternoon. And we're going to provide a small brief on the cases that we've been seeing. As everybody can see on the dashboard, we continue to see an increase in the cases, although there are some days that are seeing some decrease in the positive cases. Hospitalizations also continue to increase, but the past 2 days, as Mayor Margo said, has seen a slight decrease on the hospitalizations. We continue to monitor the positivity rate as well as the percentage of COVID patients that are in the hospital, which is one of the thresholds that the governor has set. And the way that we are going to be experiencing more restrictions if we pass a threshold of 15% of total hospitalizations of COVID-related patients. We continue to see the recoveries, and as the increase in cases, we continue investigating those cases to see what can transpire from all those numbers. Some of the preliminary information have shown that in the last couple of weeks, 14% of the people have said that they have traveled. About 13% of these positive cases have been on students or daycare attendants. Approximately 8% have shown some gatherings, either family gatherings or large gatherings. So we need to continue encouraging the people to avoid all those opportunities for the transmission of the virus, which is the gatherings, which is not wearing the mask in the proper way. If we go to the infection rate, we see that our positivity rate now is at 9.2, where before it went below 5%. We see on the positive cases how it continues to climb up on the number of positive cases, and the cases per 100,000. We're getting close to the 25 cases per 100,000. Those are not very good indicators, and we need to be aware of what we can do as a community to start having more preventive measures. And we'll come up in a little bit with those preventive measures, anticipating this climb in the positive cases and hospitalizations. We're currently at 12% on the hospitalizations for COVID-19, and the hospitalization trend continued to be in an upward. On the case fatality rate, it continues to be hovering around 2%, and the mortality rate has continued to increase. We continue to see that most of the vulnerable patients or patients that are considered to be at risk are the ones that are mostly affected by the complications of COVID-19, and among the most common ones continue to see the high blood pressure and diabetes are those conditions that affect the people the most. Approximately 4.7% do not have any underlying conditions at the time of death, and we need to make sure that we keep our loved ones with enough medication. We need to keep them going to the doctor on a regular basis so they can control the conditions, and don't let those chronic conditions get out of control, because that can predispose them to develop complications in case they get infected. We know that we have multi-generational homes, and that can create also an opportunity for the virus to spread around the house. We are going to make some recommendations for Halloween, and we are not going to allow the traditional trick-or-treating. Going from door to door, taking our children, it's an opportunity to have large gatherings. And unfortunately, some of the people that used to give the candy are older people or people that have those chronic conditions that can get infected by those kind of activities. Instead, we're recommending to create some of those car parades where they go in their car without going down, and people can provide some of those candy to those children. But as long as the people that are considered to be at risk, sitting down far away from those paraded cars, they can still say hi or goodbye, they can still dress up, but we need to do it in a more responsible way. That is going to be one of the ways that we can be controlling a further spread of the virus, especially among those that are considered to be at risk. For those that follow the Dia de los Muertos, which is a tradition for a lot of our community members where we honor our dead ones, we cannot be allowing people to gather in the cemeteries. We know that they used to bring the food that our loved ones used to eat and enjoy, but we can do it at home with our own household. We can do some virtual meetings with other family members in which we don't need to be gathering in the cemeteries. And for the Halloween, please, for the adults, it was an opportunity to gather and have parties. We are not allowing to do that. We need to be sure that people understand that we're not in a situation where we can allow all these bigger gatherings. And opening the economy doesn't mean that we're going to be continuing to allow those opportunities for the virus to spread further. So we need to do it in a responsible way, and that's why with the zoo personnel will look and see what's the best opportunity to open so the people can have an outdoor opportunity to enjoy themselves, enjoy the animals that they have, but again, do it in a responsible way. We need to remind everybody that they need to be wearing their mask no matter where they go. Even if the mall is outdoors, they still need to be wearing the mask the proper way, where it's going to be covering the nose, the mouth, and we need to continue observing the washing of the hands, or take your sanitizer with you so you can continue using it, and that's the way that we're going to be protecting our loved ones and ourselves. We have been meeting with the school officials on a regular basis, including the school nurses, and we're going to be having a meeting with the school superintendents so we can have a document more solid in how we're going to be responding to the cases of COVID-19 in the schools. We know that their plans are meant to keep everybody safe, including students, staff, teachers, and we have had some students reporting positive for COVID-19, in which we need to please recommend the parents, if they know that they've been exposed, do not send those children to school. If those children are sick, please do not send them to school again. That's the way that we need to be responsible, and we're going to be keeping everybody safe. We will be setting those thresholds in which we need to step in and provide that guidance to the schools. And superintendents, along with the school boards, need to decide whether prolonging the virtual education or allowing for in-person instruction. For those that are already continue with in-person instruction, if we continue to see this upward trend, we will take further steps in the way that they need to either prevent bringing any more children back to school for in-person instruction. And with that, we will hand it over for any questions for Mayor, County Judge, or myself.
Questions?
We're good.
If I
Mayor,
couldn't,
or Dr. O, the question is, are we legally allowed to ban Halloween or trick-or-treating?
well, since we're still under emergency situation, we can legally not allow any big gatherings, and it's in the local directors and it's in the governor's orders, so we can definitely have a say in such gatherings. We are recommending and we are telling the people not to do Halloween, and that's the way that we're going to be preventing those gatherings. So there's many other ways that we can celebrate, and there's many other ways that we can do it in a safe manner. Children can still dress up with their costumes, and they can share those costumes virtually, online with their friends, their family members. They can do contests, they can do many other things. There's activities they can do within the family, like the pumpkin carving, many different ways. We don't like to come and enforce that. We all need to take part and be responsible.
The governor has, his orders talk about 10 and above, which we have to approve, that I am required to approve any gathering that's formalized with 10 or more. We are also following the Cdc Guidelines on Halloween, and they have talked about it, and we're adapting their guidelines to fit our community. And Dr. Ocarranza has expressed that. So we think we're following the rules and the proper health protocols. And the bottom line is not to be Scrooge-like and ban Halloween. The problem is we still have a pandemic, and it is imperative that we stop the spread of that pandemic. And if we hit above, let me reiterate, we hit above 15% of our hospitalization as COVID-related, the governor is in a position to come and take and do limitations, stop on our economy. We can't afford that. And we've said from day one, all three of us have said from day one, and I've echoed it over and over. This pandemic affects us physically, it affects us financially, and it affects us emotionally. And the only way we can, until we have a vaccine, the only way we're going to be able to stop the transmission and the spread is with face coverings, distancing, and hygiene.
I do understand that the zoo, you guys are giving directions to the zoo, and today's groundbreaking of the museum, great sight for parents to finally be able to take their kids and maybe, something flying around outside that can also be safe. What are some of the steps that you're hoping the zoo will be taking to make sure the zoo can open safely for the children?
Mayor, if you can if
You
I
wanna
may
repeat
repeat the question. The question was specifically, what are some of the steps that the zoo is going to take in order to reopen safely?
I spoke to the deputy city manager before we came on today because I've been getting lots of questions from people wanting to know about the zoo. And I wasn't sure, frankly. Initially, I thought we had some staffing issues. We still may, but I talked to one of the deputy city managers whose oversight is the zoo today, and I said, from a health standpoint, Dr. Ocarranza has no problem with that. It's outdoor. You're wearing face coverings. You maintain distancing, and it's a healthy exercise, and it's an opportunity to get out and take advantage of. We got a great zoo, so it's up to staff to determine what they can do and how soon they can officially open. And as I say, I just alerted them this afternoon as to what Dr. Ocarranza's requests were, or oversight was, that permission. So I can't give you any more definitive answer than that.
No se oyó la pregunta.
Sabemos que hemos tenido menores de edad, los cuales han sido hospitalizados, y la mayoría de estos casos pediátricos que han sido hospitalizados son en niños que tienen problemas médicos ya preexistentes, los cuales lo predisponen a tener más complicaciones de acuerdo al coronavirus. Hemos recomendado a los padres de todos esos menores que tienen limitaciones o que tienen problemas médicos complejos, que cuiden a sus niños, porque si se infectan pueden tener complicaciones similares a las que tienen los mayores de edad, a nuestras personas en la tercera edad, o las personas que tienen otro tipo de problemas médicos.
Doctor, si nos puede dar la respuesta y la pregunta en inglés, por favor.
And the question was if we have seen cases of COVID-19 that have complications in the pediatric population. And the answer was that yes, we have seen pediatric cases that have developed COVID complications, but the vast majority of these children are children with complex medical conditions that can predispose them for complications that can keep them in the hospital even longer. So we have stressed the importance of those parents that have children with medical complexity to keep those children safe, to make sure that they follow all the recommended preventive measures so they don't suffer the consequences or they don't get infected with the COVID-19.
Our concern is that this most recent spike is not attributed to the holiday, rather than it is of people just getting comfortable and kind of pretending like nothing's really going on.
What is the concern as it relates to the Labor Day numbers, or the numbers that we're seeing in the cases currently are not related to Labor Day?
Well, the farther it is from the Labor Day, the less likely it is that it's related from Labor Day activities. We usually, as mentioned before, we start seeing a spike or a rise from the 10th day after the holiday, but it has been more than 14 days, which is one of the incubation periods, that we continue to see a sustained incline in the positive cases. That also tied with contact tracing and investigation activities that we have conducted tells that there is more community spread, and that is what is driving the numbers up and continue to be up in a sustained fashion. We're hoping that our message reaches each and every one of the households, either here or in the whole region. So we need to make sure that people understand that it is a community effort. It is not an effort of one person, or it's not just for my own benefit, but it has to be for everybody's benefit if we take care of each other, and that's the only way that we're going to be able to do it. We need to stress that for people that are placed in isolation and quarantine, please remain home. That's the only way that we're going to also stop the spread of the virus. And approximately 40% of the people that have positive have been in contact with somebody that has been positive. So they really need to stay home, and we understand that people need to work. We understand that people need to carry on their own activities, but we cannot do it irresponsibly by going out and going to work if we know that we've been exposed and later on we come positive and having the whole office or the school being exposed because of that.
Doctor, la siguiente pregunta, tenemos internet. ¿A qué porcentaje de contagiosos se considera cerrar las escuelas?
Estamos trabajando con las escuelas para determinar el punto en el cual podemos recomendar el cerrar la escuela, o qué tanto porcentaje de las escuelas afectadas podrían determinar el cierre de un distrito. Vamos a tener junta con los superintendentes de los distritos escolares del Paso, en el cual queremos tomar su opinión para poder tener un documento mucho más firme en el cual ellos puedan seguir esas recomendaciones y también presentárselas a su mesa directiva de cada distrito escolar.
Y si me puede dar la respuesta en inglés, the question is, at what percentage of cases would you consider closing the schools?
We've been working closely with school officials, and we're going to be having a meeting tomorrow, in which we are requesting their input so we all can have a more concrete and solid document in which everybody feels comfortable, and also that the superintendents can present to the board, in which we're setting thresholds, how we're going to be recommending closing either a school or a district, so they can take that decision along with their board, and we'll have that. As soon as we have it ready, we will present it to the media as well.
We also need to clarify that we are not the overarching control for the schools. The Attorney General has stated that the school administration and their trustees will make their determination as to what they do. We simply provide advice and counsel and hope that they can listen to us. But that was a decision made a month or so ago by our Attorney General that took away the authority of our public health authority and Dr. Ocaranza from making those decisions. So I want the public to understand we're not making those decisions. We're simply providing advice and counsel, which I would say to this date they are listening to.
There is a request for clarification. Dr. O, you said that you would be looking to ban trick-or-treating. Mayor, you stated that under the governor's orders, if groups gather more than 10, then they need to ask for permission. However, if a mother takes a son and daughter or vice versa with the dad, would that be considered a group of more than 10? How would the city be able to ban trick-or-treating?
Our intent is not to ban all forms of trick-or-treating or Halloween at all. Our intent is to make sure that it is safe for the participants and for those who are involved. The Center for Disease Control has said we should not do door-to-door trick-or-treating. And what we're talking about is, do you want to go into any of the specifics that you're recommending for? We're putting out some recommendations, I think, today. You want to go through those, Dr. Ocaranza?
Yes, sir. And as Mayor Margo says, we're here not as to ban certain activities, but we're looking more into the health and well-being of our community. We understand that there's holidays and traditions that people follow for years and years, but this year is different. We're in the middle of a pandemic. We need people to understand that there are certain activities that can pose a higher risk of becoming infected and become infected or infect others within our household. So the activities that are not allowed is going door to door trick-or-treating, because that will create a gathering around the houses that can create a high risk of infecting those that are considered to be at risk. Festivals, live entertainments, as we mentioned before, and this is not exclusive to Halloween, we're not allowing those Halloween parties or haunted houses that people used to do, especially adults. Young adults love to have those parties at Halloween and have dressed up. Please refrain from doing that. We definitely want to keep everybody safe, and we want to keep everybody healthy, and this is not just to be restrictive, it is more to be preventive. The activities that are allowed, we can do caravan of cars where they go through the houses and they can give their little pre-packed bags of candy to the people in the car, but it's not going to be done by somebody that is having those chronic conditions. It can be somebody else that is healthy, wearing their mask and just handing the candy, and having only one person in each house to hand the candy without having the kids coming out of the car. We can have costume contests among people, and they can do it via virtual means. There's different virtual platforms that people can use so they can see each other and have somebody judging who's going to be the best costume. They can do the pumpkin carving. They can do the pumpkin patch to pick up their pumpkin, but wearing their mask, washing their hands, not having everybody gathering at the same time. So those are the activities that, in contrast, there's some that are not allowed, there's some that are going to be allowed and recommended, and that's for the prevention and more for the well-being of everybody.
I was just going to say that Parks and City Parks is planning some trunk or treats at some of our community centers. That's where you drive up, and we'll put candy in the trunk of the car, and you can continue. There are all kinds of ways to do things, but we're planning. We're trying to do what we can do that means it's safe for families and for those that are vulnerable.
Given the most recent spike, what's the level of concern of the return of sporting events, specifically today and tomorrow with the return of high school football and some fans in the stands? What's the level of concern going forward?
Dr. O, if you could repeat the question.
The level of concern for sports events, especially high school football, is coming back. Many of the school districts have banned spectators for those sports events in an effort to contain the spread through those events. We know the importance of those sports events, and we've been telling people to stay healthy. If kids want to play sports, they need to stay healthy and not getting into activities that can engage in risky situations where they can get exposed or sick. We already published a guideline for return to play in which we are looking at, again, making sure that those teens or youth athletes return to play in a safe manner, because we know that the COVID can create inflammation in the heart that can be disastrous if they start going back to sports right away after being infected with the COVID. So it is a responsibility of everybody. We love to see our children play. We as parents, everybody in the whole family, but the schools will stream the games, and everybody can enjoy watching them play in a safer manner being at home. So it is the choices that we make that can keep us safe or can keep us going up in the numbers the way that we've been seeing it. The same as with the economy and the way that we've been opening other places. There's choices that we can take where we're going to be safer, like in the restaurants. If we take out, if we do the curbside, that's a better option than having large gatherings.
I think it's important to, when we started, the mayor and I felt that some of the orders were contradictory to our community, where we were at. And I think just to be clear, the orders, we were pretty comfortable with the orders. It's not adhering to the orders that becomes the issue. If you look at the order and you look at Halloween and we follow the orders, it's pretty well stated as to what we can and cannot do. The problem is the community taking to their own hands or what they feel is important or what they feel they should continue to do. So the order itself is not a problem. We feel comfortable. The going from 50 to 75%, people felt that was going to be an issue, and the issue is not going from 50 to 75%. Is everyone dropping their guard and feeling that we could go to 50 to 75% and do it differently than what we did when it was at 50. So if we maintain at the protocol at every step of the way, we can open the economy. When the community decides that they're going to go beyond what the order states, then we have the confusion and the concerns and the problems.
Déjeme le perdón. En las últimas semanas se ha visto un aumento en casos de coronavirus entre los menores de edad. ¿Por qué se debe a esto?
Hay varias posibilidades en las cuales se puede deber el aumento de casos de coronavirus en los menores de edad. Puede ser una de que ya no los tenemos a nuestros menores de edad en la casa y hemos empezado a sacarlos y exponerlos a otras personas. Y muchas de las ocasiones pueden ser expuestos por miembros de nuestra propia familia. Cuando tenemos esas reuniones familiares, cuando tenemos muchos de esos otros grupos en los cuales llevamos a los niños. Y la otra cosa que es también un factor importante, nosotros como padres no les hemos acostumbrado y enforzado el que tienen que usar el cubrebocas. El hecho de que son menores de edad sentimos que no es una necesidad de que tengan que usar el cubrebocas, pero sí lo es. Y tenemos que entender que los niños tienen que acostumbrarse, igual que se acostumbran a la silla del carro, a usar el cubrebocas porque es lo que va a salvar vidas y es lo que los va de una manera a proteger, sobre todo cuando regresan a la escuela. Sí hemos visto ciertos casos en la escuela, pero no creemos que esos casos empezaron en la escuela, empezaron más bien en la casa y fueron identificados más bien en la escuela.
Doctor, just for the English speaking, in the last several weeks, we've seen an increase in cases of minorities. What is the cause of this?
The increase in the cases in the pediatric population or minors having positive cases of COVID-19, it's multifactorial. And the way that we've seen our parents, they're bringing their children out to those family gatherings. Sometimes those gatherings within family members or extended family is what give rise to large exposures, and we're having those children becoming positive. We have some positive cases in the schools, but we don't believe that it's in the school where they got infected. It's somewhere else in the house where they got infected, and we just identified them to be attending the school as well. So one of the main reasons also, the fact that the children are getting infected, is that many of the parents don't tell the kids to be wearing their face mask. We, as parents, need to be responsible and we need to get them used to be wearing their face mask, because that's one of the line of defense that we have against getting infected and getting the secretions or some of the infected secretions going to other family members or other people when they're outside. So children by nature are going to be curious, they're going to be touching their face, they're going to be touching their mouth, and that can lead to also children getting infected a lot easier.
The next question on the internet is with regard to trick-or-treating. Does the city plan to have any penalty for parents going with their children door-to-door in groups of less than 10, for example?
We don't want door-to-door trick-or-treating, period.
We are trying to discourage people going from door to door because of the situation that we have explained, and it's better that they either attend one of the rec centers that are going to have a trunk or treat, or have a caravan of cars where they can organize themselves in their neighborhood and they can distribute the candy in a safer way instead of having the children going down door to door, because it's not going to be your own children, it's going to be your children plus the next one that comes to you and the next one, and by the seconds you're going to be having a large gathering around the houses that are distributing the candy, because we know it. A lot of the children know where they're going to be giving more candy, and they're going to be gathering there. So it is our concern, and mainly my concern, that children are going to be gathering and more people are going to be infected, and that's what we're trying to prevent. We're trying to prevent those instances that can lead to faster spread of the virus. So it's not that we want to just interject into these holidays. We want to make it in a safer way, taking into account the health and not being looked at as a restrictive nature.
I see no other questions either online or here in person. So with that, yes, Mayor.
I'd like Chief Rodriguez to talk about the flu shots that are critical. As Judge Samaniego talked about our flu season beginning today, but our peak, and where we're giving out free flu shots. And I want Chief Rodriguez to talk about where we are real quick on the numbers.
So joining us is Assistant Fire Chief Jorge Rodriguez, who is also the Office of Emergency Management Coordinator.
There you go. Good afternoon. So we've kicked off with the Department of Public Health, supported through the El Paso Fire Department and Office of Emergency Management, through the Emergency Operations Center, supporting the flu campaign, the Power Flu campaign. They've have done an extensive amount of immunizations over the last 2 weeks. We've hit 5,600 immunizations. Typically on a regular flu season, we average around that number between the city of El Paso and fire department initiatives that they do year to year, but that's across the whole flu season. So what they've done over the last 2 weeks has been great. great partnerships with the county. We just had a very successful event at Escarte Park last weekend, and also with our schools. School districts have been great partners in doing that. So we have a little over 30 scheduled events that are forthcoming. Most of those are listed already on the website that provide where, when, and where, and enrollment information is provided there as well. So again, it's important, as the judge and the mayor and Dr. Ocaranza have stated, our ability to prevent that perfect storm of COVID and the flu, so it doesn't impact severely our hospital system, is critical. So please, if you are within that vulnerable population group, and also in general, go out and get your flu immunizations. Also on the testing side, just a quick note, as a press release that we put out on Friday, but to reiterate, our testing with the state has been extended to October 31st, so we have plenty of capacity at those locations and then the city. We're also including, beginning October 5th, we're also adding additional lanes so you can get your immunization at the city sites, which are at the Don Haskins Rec Center on the west side and also at the airport location. So all that information is available on epstrong.org and also on the Power Flu Campaign website. So thank you.
To reiterate, you can get your flu shot and your COVID test at the same location.
I'm going to, if I may, I'm going to ask also Enrique Dueñas to go ahead and translate, because we believe that it is a critical information.
Buenas tardes. El Chief Rodríguez lo que mencionaba es de la nueva campaña de inmunizaciones que se ha estado llevando a cabo por parte del Departamento de Salud, la Oficina de Emergencias y el Departamento de Bomberos, así como el Condado del Paso. En esta temporada, en las últimas 2 semanas, se han hecho más de 5.600 vacunaciones, lo cual es equivalente a lo que normalmente haría la ciudad en una temporada entera. En este caso, tenemos todo este número, que han sido apenas en 2 semanas, y equivalen a todo lo que se hace realmente en la temporada cada año. También el Chief recordaba a toda la ciudad que siguen los centros de pruebas de COVID. El 5 de octubre se van a estar añadiendo nuevas líneas en las cuales se va a poder también realizar inmunizaciones, lo cual quiere decir que tanto se podrá hacer una prueba COVID como se podrá hacer también una vacuna contra la influenza. Y por último, recordar a la ciudadanía que nuestra capacidad de hospitales depende muchísimo de la participación de las personas. Entre más puedan vacunarse y más se pueda prevenir la influenza, más también podemos evitar que se abarroten los centros hospitalarios y de esta manera se puedan atender a los pacientes con COVID. Gracias.
Thank you all. This ends it.
Yes, ma'am. Yes, ma'am.
Of course.
The question is, well, if you can provide an update with regard to the compliance. Yes, thank you.
So as we've reiterated, compliance is an ongoing process. We still have a big makeup of a variety of groups that are going to various businesses, working the Education Task Force to make sure that they have the resources, knowledge, but they've been very active since Labor Day predominantly. So, I mean, they continue to do the work every day, ensuring that those orders are being followed by businesses, but also, within residential areas, if there's issues there, those are being addressed. So that's our update. Thank you.
Thank you all.
Thank you.
Thank you, everyone. That concludes today's press conference. Have a safe weekend.